We chose to review Public Health by Raegan Favaloro, Paige Gilcrease, and Dale Baronet. The learning objectives are: what is public health, and what are some agencies that deal with it? What are vaccines? What is hunger and poverty? What are some causes? Should you vaccinate your child? Why or why not?
Public health is the health and population as a whole, especially as monitored, regulated, and promoted by the state. Humans created thousands of health agencies. Some are paid by taxes, and others are by nonprofit organizations. Public health agencies, both governmental and non-governmental, can range from an international level to a local level. Governmental agencies are supported by tax dollars, and the most well-known national agency is the CDC, Centers for Disease Control and Prevention. Non-governmental agencies are supported by charitable acts. They usually call themselves nonprofit organizations in order to avoid paying taxes. And the most known nonprofit public health organization at the national level is Red Cross.
A vaccine is a product that produces immunity from a disease that can be administered through needle injections, by mouth, or by aerosol. What are some vaccines that are recommended for young adults? They are the human papillomavirus vaccine, the bacterial meningitis vaccine, and the influenza vaccine. The CDC estimates that vaccines given to American children over the past 20 years will help prevent 732,000 deaths.
Hunger is a feeling of discomfort or weakness caused by lack of food coupled with the desire to eat. Poverty is a state of being extremely poor. Possible causes of hunger are famine, poverty, and natural disasters. Possible causes of poverty are the economy, lack of education, overpopulation, diseases, and environmental problems. World Bank considers living in poverty as living off of less than $1.90 per day.
Some of the arguments for and against child vaccination are as follows. They have pros and cons. The pros are they can save children's lives, the ingredients in vaccines are safe and the amounts used, major medical organizations state that vaccines are safe, and adverse reactions to vaccines are extremely rare.
Some of the cons are vaccines can cause serious and sometimes fatal side effects. Vaccines contain harmful ingredients. They infringe upon constitutionally protected religious freedoms. Vaccines are unnatural, and natural immunity is more effective than vaccination.
Now, let's see if you were paying attention. The CDC estimates that vaccines given to American children over the past 20 years will help prevent how many deaths? A. 163,000. B. 1 million. C. 732,000. Or D. 15,000. The answer is C. 732,000 deaths.
What does the World Bank consider as living in poverty? A. Less than $1.90 per day. B. Less than $10 a day. C. Less than $1.89 a day. Or D. Less than $5.50 a day. The answer is A. Less than $1.90 a day.
Which agency deals with the public health at the national level? A. Centers for Disease Control and Prevention. B. Parish Health Unit. C. Louisiana Department of Health and Hospitals. D. World Health Organization. The answer is A. Centers for Disease Control and Prevention.
This is a video on public health in case you want more information.
Even before a child is born, a quest to ensure its long and healthy life begins. All over the world, public health programs work to improve the health and well-being of communities by identifying the risks that affect different people in different places at different stages of life, and finding the best ways to minimize them. It's about giving everyone the best chance to lead long, healthy, fulfilling lives from the very beginning to the very end. A child dies every 3 seconds from infectious disease, but public health interventions can prevent this by promoting things like breastfeeding, immunization, and antibiotics. Where children die because they have no access to safe water or basic sanitation, public health programs can make water safe and conditions sanitary. Where research shows us who has the highest risk of developing certain conditions, public health applies it to the real world. It turns evidence into the advice and practical help we need to lead active, healthy lives away from danger. It helps us make the right choices and form the right habits that impact on our health now and long into the future. Poor health doesn't just cost lives, it costs money too. By preventing, detecting, and treating disease as effectively as we can, public health can help to halt the spiraling costs of treatment, saving lives and saving money. Public health is about understanding the huge impact that our financial, social, and environmental circumstances have on our health, and reducing the differences between us to make us all healthier. It's about making health achievable, in mind and body, at home and at work, by supporting individuals, families, and communities in the environments they live and work in. It's about working to ensure that no one is left out or left behind as we strive for better. Public health, preventing disease, prolonging life, promoting health, for everyone at every stage of life.
Thank you for watching our review on public health. Happy studying and good luck on your exam.